Hi, my name is Donna. I'm one of the care team nurses at Peak Vista Women's Clinic here with Peak Vista. I am also a lactation consultant, so we're going to learn about understanding breastfeeding. These are the different positions for breastfeeding. The football hold is the one in the upper left on your screen. It was really good for a mom that might have had a C-section because her belly's tender, and so it takes the baby off of your belly and onto your to the side so that you can breastfeed. There's also the cross cradle, the laid back position. That's really good for a mom, again, in a C-section where you want to take the pressure off your belly. And then the sideline, great for at night.
There are many breastfeeding positions for moms and babies. The main thing is to relax and be as comfortable as possible. Over time, you'll find what works best for you and your baby. Just remember that any position should include these basics. Hold her tummy to tummy with her nose across from your nipple. Support her whole body, not just her head. And be sure her body is in a line, not twisting or turning. In a laid back position, you recline comfortably at about a 45-degree angle. Place your baby across your stomach with her cheek near or on your breast so she can find your nipple and latch on. Use pillows to keep you comfortable. If needed, support your baby's head with your arm and her feet against your thigh, your arm, or the bed. If you had a cesarean, you can position her in a way that avoids your incision. The cross-cradle position is also helpful for new moms and babies. Lean back a little and use a pillow or a stool if it makes you feel more comfortable. Support her upper back and shoulders with your hand, keeping your fingers low behind her ears. If it helps, you can hold your breast with your other hand. With the football position, hold your baby close in along the side of your body. Use pillows to support your body as needed. This position lets you clearly see how your baby is latching on. This hold can be useful if you have twins, a premature baby, a cesarean birth, or large breasts. In the side-lying position, you and your baby lie on your sides, tummy to tummy. It may take a couple of tries, but once you learn how, this position is great for resting and nursing. Remember to keep all loose blankets and pillows away from the baby. Finally, when your baby has more neck strength, you can use the cradle hold, which supports your baby's head in the crook of your arm. Over time, you'll find your favorite positions, and so will she. Just remember to be as relaxed as possible and hold your baby close into your body so she can get a deep, effective latch.
Pretty girl.
I think for one at a time, I really found cross cradle to be comfortable, and then we kind of evolved to I'll have one in a cross cradle and one in a football, laying on top of the other.
So when you get ready to latch the baby on, get a comfortable position. You can have the boppies, you can do pillows, a nice comfy chair that supports your back and your arms. You're going to hold the baby close, tummy to tummy, because we want to make sure the baby's coming at the breast straight on. You hold your breast behind the areola. When you're first breastfeeding, the baby doesn't have a good latch sometimes, so it's really important to hold that breast so that baby can get that latch and stay close so you don't get sore nipples. Align your baby's nose with your nipple and gently tickle the upper lip. When your baby's mouth opens wide, you pull him up and over and quickly in. There's a video clip here which would be great for you to watch on how to latch that baby.
Deep into the breast.
The most important part of breastfeeding is knowing that your baby has a deep, effective latch. An effective latch allows your baby to get more milk and you to be more comfortable. Many babies latch on easily when mom is leaning back and relaxed with her baby on her torso, sometimes called a baby-led latch.
And then you can take away this hand and you can support his head and your breast with this arm and shoulder.
When you're leading your baby to latch, lean back slightly so you are relaxed and comfortable. Hold your baby close into your body with her tummy facing yours. Place your baby so her nose is right across from your nipple. Keep your hand behind the areola, the dark area around your nipple. You can interest her with a drop of expressed milk. Tickle her upper lip. When she opens her mouth wide like a yawn, pull her in quick and close. Look for the signs of a deep latch when you breastfeed. Your baby's mouth is open wide, her lips are flared outward, and her chin is pressed into the breast. You should be able to see more areola above her mouth than below. Your baby's ear and jaw should move when she sucks. You'll feel a pulling or tugging that's not painful, and you may be able to see and hear her swallowing. With a shallow latch, only the nipple or a small amount of the breast is in the baby's mouth. You may feel biting and pinching, nipple pain, and you may hear clicking or smacking sounds.
And then when she opens up her mouth wide, then you can just bring her in nice and quick.
In the early days, it may take some time and practice for your baby to latch on correctly. If your baby has a shallow latch, you'll need to re-latch. Break the suction gently to protect your nipples by pushing in on your baby's cheek or inserting a clean finger in the side of her mouth. Be patient with yourself and your baby. The more she breastfeeds, the better she'll get at latching on. If you have problems breastfeeding, talk to your nurse or a lactation consultant. They can help find the cause and a solution.
Relax your shoulder.
This is an example of a deep latch and a shallow latch. From the video clip that you saw before, you'll see the picture on the left shows that nipple is way into the mouth, and the picture on the right shows that the baby just has a little bit. That will cause you to have sore nipples. So it's very important to try to work on getting that good latch and a correct latch when you're first breastfeeding. Lactation consultants can help in the hospital.
This animation shows what a deep, effective latch looks like. With his mouth open wide, the baby comes to the breast chin first, with his head tilted back. He latches on so that the nipple is drawn far inside his mouth all the way to the soft palate, which is very flexible. Here, your nipple can expand and the milk can flow without causing pain. With his tongue above his lower lip and under the breast, he sucks quickly, which helps trigger the letdown reflex. When the milk starts flowing, his sucking becomes deeper and stronger. He settles into a rhythm of suck and swallow. A deep, effective latch allows your baby to receive more milk and you to be more comfortable. With a shallow latch, however, the nipple is not far enough inside the baby's mouth. When it only reaches the hard palate in the front of baby's mouth, the nipple gets pinched. This can damage the nipple and result in your baby getting less milk.
This is an effective latch. The mouth is open wide, the lips are flanged, large amounts of breast is in the mouth, more areola is above the baby's lip than below, the ear and jaw are moving, active sucking and swallow can be heard, and you feel a strong tug. That's not painful, but you feel that tug that the baby is getting the milk. An ineffective latch, this is a great example, shows that that baby just has the nipple. And what happens is the baby needs to have that areola to sort of bring out that milk from the breast tissue. The mouth is not open wide, small amount of milk is coming into the baby's mouth. The lips are curled in. The clicking, smacking sounds like the baby's chewing on the nipple rather than sucking. You feel pain. Your breast does not soften after a feeding, and the nipple looks pinched, sort of like a lipstick. Here's another good example of a deep latch and a shallow latch. A typical feeding for a baby, you offer both breasts. You try one. If that's not good, try a different position. Sometimes women have different density on their breasts, so you might feed in the football hold on one breast and the cross cradle on the other. It's what your baby is doing and what's comfortable for you. You burp between the breastfeedings. You alternate side for each feeding. So if the baby only fed on one side, the next feeding, make sure you feed on the opposite side. And the feedings should take less time as the baby gets more efficient and grows as to taking off the breast milk.
Once you are comfortable and your baby has a good latch, feed her for as long as she is actively sucking. When she releases the breast or her sucking slows down, try to burp her. Keep in mind that breastfed babies don't always need to burp, especially in the first few days. Then, offer her the second breast. She may take it if she's still hungry. At every feeding, switch the side that you start on to make sure each breast is getting the same amount of stimulation. In the first weeks, feedings take a lot of time, but usually become shorter as your baby gets better at breastfeeding.
Between 5 and 45 minutes is normal for a newborn, but as the baby gets better at nursing and baby gets more efficient, that time will decrease.
I think I was surprised how much time it takes by the time you get settled, and then he wouldn't latch on right away and you finally get him on, and then you burp him and they switch sides and he won't latch on that side either and he cries. But then I was surprised over time how much I liked it. It's just really a good bonding time. It kind of gives you some quiet cuddle moments. 6 months or a year in, when you're much better at it, it's enjoyable and relaxing, and it feels good to know that you're giving your baby what they need.